In this video, I'm going to show you a great position for neck pain relief and shoulder relaxation. It can be used as a technique during the treatment or as a part of the home program. The advantage is also it works by itself, but also it can be combined very easily with different manual techniques or with dry needling or traction, a few different combinations. The biggest advantage of this technique is that it gets the global inhibition of these very often overactive muscles rather than getting the similar effect through the just isolated technique. It tends to have that relaxation effect for way longer, and it can be actually repeated as often as the patient needs. The most important step in this process is basically relaxation rather than trying to force something. So what is the main difference? To relax muscles like, let's say, the traps or levator, what we can use is post-isometric relaxation, where you're just pressing into the muscle and then just relaxing, stretching it. We can use some positional relief, where you're just going to shorten the muscle and hold it in that shortened position. We can use for example, some deep pressure. We can use needling, or we can use activation of the antagonistic muscles, but all of this is going to give us the relaxation only on the very isolated pattern. In comparison, when we get the similar effect in this position, it tends to last way longer, and the person is able to feel it and integrate it into their daily routine way easier. So now I'm going to just take you through the basic setup. So we are starting in the prone position, so lying face down. Arms can be over 90 degrees of flexion. Then you're just going to place your forehead, let's say, on the arms. This is usually the biggest mistake. What people do is usually there is a common cue to push the elbows down to give the neck a little bit of support. This is going to activate the pecs, which we definitely don't want to, because there is, like, usually the global pattern is with the pecs there is neck extension and pelvis extension. So what we want to activate is the uprighting. So you're going to be pushing the elbows basically into that direction, there and down, and you're going to get that little bit of lift of the neck, and then just relax. And again, just push those elbows away from the body, and then again relax and relax. The next step could be, when you have this nice and stable, it's going to almost like lift the thoracic spine towards the shoulder blades. Then you can start lifting the neck, kind of using the tuck neck position, and combine it with tilting the pelvis posteriorly. So you're going to tilt the pelvis backwards. Then, so that's going to be almost like the complete pattern, where you're going to be just pushing the elbows away, getting nice thoracic spine, nice and upright, activating deep neck flexors, and combining it with the posterior pelvic tilt and a little bit of intra-abdominal pressure. So how you know you're there right is if you push that elbow over there, your trapezius should be perfectly relaxed. So even for the patients, this can be a very good way how to know it's basically they're doing it right. They should be able to rotate a little bit, explore that motion pain-free. When they are going to be lying on the belly, the most important is to push the elbows out this direction, almost like something is pulling your head forward. Also, by tilting your pelvis posteriorly, you're going to get that extra stretch in your neck, which is going to help to relax all of the back line, all of that line of the trapezius, all of the paraspinals, in combination with breathing, with a little bit of extra, maybe moving, or that intent of going almost like going this way. That's going to help to relax those muscles. Okay guys, hopefully this was helpful. I was planning to do it very short, but the explanation took a little bit of time. Hopefully you found it helpful. If you did, please give it a like, subscribe. I'm going to be bringing more stuff like this soon.